Hi everyone, I am Shiny MD Nila and today we're going to discuss chemotherapy. So what is chemotherapy? The word chemotherapy literally means treatment of diseases by chemicals. From the German chemotherapy and its roots, the scientific prefix chemo means chemical and the Greek therapeia means healing. Chemotherapy is therapy of infectious diseases and malignancy by use of chemicals called chemotherapeutic agents. Moreover, it may be defined as a treatment of systemic infection caused either by bacteria, fungi, protozoa, or helminths with no or minimal effects on the host cells. Chemotherapeutic agents, also referred to as anti-neoplastic agents, are used to directly or indirectly inhibit the uncontrolled growth and proliferation of cancer cells. They are classified according to their mechanism of action and include alkylating agents, antimetabolites, anti-tumor antibiotics, mitotic inhibitors, and corticosteroids. Other chemotherapy drugs are eribulin, hydroxyurea, hexabepilone, and mitotane. For the historical background of chemotherapy, we have Paul Ehrlich, a German organic chemist in 1890 to 1910. He coined the term chemotherapy and is considered as the father of chemotherapy and was rewarded with Nobel Prize in the year 1909. Gerhard Dumac, a German scientist in 1932 to 1935, discovered protonsil, which paved the way for the most popular antibacterials of the modern era, the sulfonamides. Pasteur and Duvert also has a contribution in chemotherapy. They are the first to demonstrate the phenomenon antibiosis. 1941 is the golden age of chemotherapy. This is the year penicillin was used in treating human bacterial infections, which is found by Alexander Fleming in 1928. Howard Florey established penicillin as an antibiotic and was used during World War II on wounded soldiers. Salman Waxman in 1944 isolated streptomycin from Streptomyces grueus. In 1947, chloramphenicol was discovered. In 1948, chlortetracycline was discovered. In 1958, semisynthetic penicillin was discovered. In 1956, amphotericin B was discovered. In 1960s, cephalosporins was discovered. In 1964, gentamicin was discovered. In 1980s, fluoroquinolones was discovered. Up to this day, research continues to find newer antibiotics in place of the older ones to which the pathogens are becoming refractory. Principles of chemotherapy. Successful chemotherapy is based on the following principles. The first is the basic principle of the chemotherapy is the selective toxicity. The drug should selectively inhibit or kill the disease-causing pathogenic organism or cancer cells without affecting the host cells. Next is that chemotherapy must be rational and needs to be supported by either a clinical or microbiological diagnosis to identify the pathogenic organism. Another principle is the characterization of the pathogens, including its sensitivity to an AMA is essential. Next is the selection of an appropriate drug based on pathogenic organism, patient factors, and drug factors. If possible, it is better to use a narrow-spectrum antibiotic which is more selective and thus cause less interference with the normal resident bacteria. The next principle is that the drug should be used in a proper time, by proper route, at appropriate dose rate, and for a proper duration. If an antibiotic is used, it is better to administer it as immediate as possible, at a high dose for a short period, and continue beyond 48 hours after disappearance of symptoms. Next is attainment of effective concentration of chemotherapeutic agent for a sufficient period at the site of infection is very important. Specific and appropriate supportive therapy should be undertaken to overcome the infection.